1. Let's welcome into the NCW Live studios Dr. Ann Diamond, who's running as a candidate who will be filing this next week for a position in the state legislature to represent the 12th Legislative District in the House of Representatives. Dr. Diamond, thank you for joining us.
Thank you, Steve. It's a pleasure to be here.
Now, you made your intentions known very early.
I did.
Prior to the New Year, as a matter of fact. So let's talk about that and what was the decision-making factor for you to run for this position?
Well, I think the main reason was I didn't feel represented. I had gone to Olympia with a number of docs to talk with our current representative, Carrie Condata, and we went to talk about mental health and talk about tobacco. And he made it very clear that we should be talking to someone else. He pointed me actually towards Eileen Cody, who was in charge of the Health and Wellness Committee. And I walked away from that thinking, I just took a day off from work, came with all these docs, wanted to talk to my representative for the allotted 15 minutes, and there didn't seem to be much purchase. He didn't care.
Okay.
So we have a representative government, and when you take the time and you don't feel represented, you get to stand back and decide what can you do to be more effective. And I decided I wanted to run. I wanted to have a say in what's happening in Washington with healthcare.
Okay, so are you running for or running against? Obviously, Mr. Condata has now dropped out of the race.
Honestly, for the first, so I announced back in November, and as I met people, anybody who's had a 16-year incumbency has made some enemies and made some friends. And a lot of times I heard people talk about what they didn't like instead of what they were for. And so consistently, you actually took my line. I'm saying, well, I don't want to run against, I want to run for. So I've been touring the district and asking people what's most important to them. I'm fairly well known as a family physician in the Methow, in Okanagan County. I started first working in Brewster and then started my own clinic. And
it's the Winthrop Country Clinic, correct?
It was the Winthrop Country Clinic. It is now the Methow Clinic.
Oh, I beg your pardon.
No, that's fine. It was the Winthrop Country Clinic for 16 years when I ran it, and I had the good fortune to find a buyer, and Confluence bought it. So now it is the Methow Clinic, and I worked with them for the first year for the transition, and then I have separated so that I could run this race.
So what, you're a primary care physician, correct?
I am a family physician.
A gatekeeper, in other words?
Well, gatekeeper makes it sound like you're keeping people out.
No.
And I think primary care, certainly in a rural area, everybody would rather stay at home and see their doc than drive 2.5 hours to Wenatchee. So we did a little bit of everything. And one of the joys of being a small town doc is you're working in a community, so you know who is in the grocery store buying. Not that you look in people's grocery baskets, but I have had people behind me in the checkout line who've just come to see me about weight loss, and I turn and they have ice cream and cookies and whatever in their basket, and they literally have taken the basket back and put things back on the shelf with me saying absolutely nothing. So small town gives you an opportunity to see how people live their lives.
Sounds very familiar to my upbringing. My dad was a small town doctor back in the 50s in Southern California, and I do recall his relationship with his patients. Often it was a barter situation.
Right, no.
So obviously...
I've been paid in eggs.
Well, we've been paid in tamales, so thank you very much for that. Dr. Diamond, obviously
I wanted to ask you a question about your dad. So was he an independent physician? Did he work on his own, or was he part of a larger practice?
No, he was. He had a partner, just a small little office. And just him and his partner and a dentist, and that was it.
Oh.
Yeah, very small practice.
So we grew.
I used to go on house calls and hospital rounds with my dad back in the day when they did that type of thing.
No, we do that. And still have. I would always do newborn visits, and we grew to be, well, it's currently 5 providers. So it's an independent practice.
Well, let me ask you this, Dr. Diamond. Being on the front lines of medical care, you obviously have your opinions and ideas for how we can improve health care, and that is one of the main planks in your platform early on in your campaign. Why don't you give us your philosophies on that?
Okay. Well, first off, I think primary care is people's first access to medicine. And in general, what we do as docs is only a small part of health. So you know that health encompasses food and housing and just having a safe place to live, a secure neighborhood, a good school. So you can make it very broad, but the primary care is having a relationship with a doc who can help you with both prevention and guidance in good health. What's happened at some state levels, I would say specifically in Rhode Island, they are, as a very small state, able to focus on primary care. And they're an incubator. They're trying new things. And one of the things they're trying to do is offer primary care, basic health to everyone. And they're talking about people buying insurance for specialty care and hospitalization. The primary care is what would pay for chronic meds for diabetes, for hypertension, helping people take care of the issues that are day to day, not the emergencies. And basically that's what I've done for the 20 years that I've been in Okanogan County. At the state level, we have a basic health plan. How do we best support that and make that accessible to everybody? I don't want to see people bankrupted because of inability to pay for medical bills. I have many patients who have been able to see me because of the Affordable Care Act, the ACA, Obamacare. I have patients who can count the days until Medicare is going to descend. They know that Medicare is that goal that they're trying to get to. And that's unfortunate because then they delay care. So one patient told me when he got on to the Affordable Care Act that the best thing that Obamacare had ever done for him was get him a colonoscopy because he had colon cancer and he knew it, but he wasn't going to see a doc if it was going to bankrupt his family. So I want healthcare to be affordable, and I think the states can do a lot to make that happen, and I'd like to work on that.
Let's talk about some of your other planks of your platform, because that has kind of evolved since you first announced your intentions to file.
No, and that is very true. Let me make one other point, because people will argue that what can a state do when it comes to health care? They expect it to be a federal program like Medicare.
Well, that's pretty much a dysfunctional Congress that can't deal with it themselves, and a lot of states are now looking to bring it.
You said it, not me, and I would agree. The states have a lot of power. So Medicaid is jointly administered. But also what's happening in our legislature right now, much of it has to do with controlling the pharmacy chain, so the supply chain of medications. And it's fascinating to see what other states are doing. And there are lots of different programs to try to allow people to bring meds back from Canada more cheaply, or to buy medications in bulk as a state, like the VA does. Medicare recipients probably pay 10 times more for meds than folks from the VA.
Well, it's one of the big drivers in medical costs.
It is. Yeah. And the other big driver in medical costs, I would say, is for-profit medicine. So why are we turning it into a for-profit system? You can make money. You deserve to make a living while you're in medicine, but you shouldn't have the people who own the medical business be shareholders as opposed to the patients who are paying the premiums.
Understand.
So there's a lot on healthcare that would be exciting to work with. And being independent, so I am running as an independent. You hadn't mentioned that. Being independent, right now, our legislature is very close to 50-50. It's 48-50 on a lot of votes in the House. And I don't know if you remember, there used to be a roadkill caucus. Do you know about that?
No.
So back in 2000, I know they were in existence in 2011.
The Roadkill Caucus.
Roadkill Caucus, so I got you on the name.
All right.
The Roadkill Caucus was a bunch of middle-of-the-roaders. They were moderates who were tired of being run over by the extremes of the party. And so they formed their own caucus, and with 5 to 10 people, they could swing the votes either way. And they held together for a couple of sessions and really made a difference. So as an independent, when there's 4850, I'm new to this, I'm a doc, but I see an opening for being able to have a strong voice if I can bring in a couple other moderate voices who want to find common ground. So I'm very excited about running independent.
With the few minutes we have remaining in our program here, and I wanted you to be able to outline and explain further to our viewers your main objectives, I guess, going forward. Now, healthcare, obviously, one of those issues that you're very passionate about. Economic development is a big issue here. Affordable housing is a huge issue in North Central Washington as well. Your thoughts on those issues?
Okay, and I was going to, we talked before, and I was going to mention education also, because McCleary right now is half the budget, but I don't want to steer away from your question, because I want to answer your question. So on housing, what's fascinating to me, again, I've mentioned that I'm from the north part of this district, and to explain further, it's only part of Okanogan County that's included with all of Chelan, all of Douglas, and a part of Grant County. So we're a 4-county region.
It's a huge district, really.
It's a huge district, from Grand Coulee out to Stehekin and up to Stevens, so my car will get lots of mileage. But what I'm learning is I know my community well. I've been there for 20 years. When I come out of my community and I visit, say, Chelan, and meet with the mayor and talk with individuals there, they have the same problems we do. Chelan and the Methow and Leavenworth and Wenatchee and East Wenatchee too now is having more of a crunch when it comes to housing. They're all waking up and seeing that there isn't enough housing for the people who want to live there. And that affects economic development. So I will speak for Chelan since I started there. They have individuals who are driving 50 miles to work service industry jobs, and then driving 50 miles back and doing all their shopping where they're living. Right. So these workers come in to a community, but they don't partake in that community. They're not in the schools, they're not housed there, they're not shopping there. And Chelan's losing millions of dollars, and the neighborhood feel that they want. So housing has risen to one of the top issues for me in seeing how it affects new technology can't move here because there's no place to live. The hospital, if you talk to Confluence and CVCH, they're recruiting doctors and nurses, but then the doctors and nurses can't find a place to live here. Pateras, after the fires, got a special grant to have a mental health specialist who could help them. No place for that person to live. They didn't leave because of the salary or because they couldn't work in the community.
Affordable housing.
Because they didn't have a place to live. So we have to address that. And I think,
especially in areas I would imagine that base their economies on tourism, because it's traditionally not a family wage kind of a job, but where people work in the hospitality industry and those types of related sectors of the economy.
Except that Wenatchee is becoming more of a tourist destination with the trails and Mission Ridge and the beautiful river. I mean, there's so many things here that allow access into the wilderness, and yet that's not its primary. And it's having trouble with housing too. So it's not just, it's all of us. And I think that's what's fascinating to me is the Okanogan is a microcosm for all of this district. We all have the same problems. And as you talk to people, you realize that we have more in common than we do apart.
Absolutely.
Can I make a point?
Yes, you may.
Because I think it's one of the things that...
This is your time.
Okay. I just want to go back to one of the more exciting things for me. I started this as an independent back in November. And since then, there has become an independent platform in Washington. So my candidacy and my announcement predated that, but I had the opportunity to meet with some of the other independents who are starting to appear on the landscape. And I have to say, to be with like-minded people who are tired of party politics, are more concerned with what does the constituency have to say rather than a party platform, has been invigorating. And I really hope that people will take the time and find common ground, figure out what it is that's most important to them, and ask me about those issues.
Well, there's so many issues that we could talk about right now.
I know, we're going to run out of time.
Unfortunately, due to time constraints, we can't, but How can we learn more about Ann Diamond and your campaign?
Okay, so I have a website, and it's www, I haven't had to recite it before, so I have to think for a second, www.diamond, the number 4, house.com. So that's all one word, Diamond for House. And on that website, you can contact us. I respond to most of the emails that I get. And so if you wish to, there is an elect at diamondforhouse.com.
Okay.
And that is an email that will get to me.
Well, I appreciate you stopping by and talking to us, and we wish you the best of luck in your campaign.
Thank you.
And I'm sure our paths will cross numerous times before Election Day. So,
I hope so.
Hopefully you'll have a good campaign, and I know that so far we have 3 candidates that are vying for that position, and
I
possibly
think
more
will
after
come
filing
out.
week next week. So good luck to you.
I appreciate it. Thank you for the time.
Dr. Ann Diamond joining us here. She's a candidate for the 12th District State Legislative Position 1.
Thanks
Thank you
again.
very much. I'm Steve Hare, NCW Live News.